Hello, this is Dr. Nguyen. Today I would like to talk a little bit about dental implants. Dental implants recently has been a topic that's a lot of patients ask about. So I would like to make a little small clip to talk about it to help everyone to have a better understanding of what is the dental implant is about. Dental implants is actually including three parts. Um, the parts that we are seeing uh, is normally just a crown. There's a part that go between the crowns and the part underneath the bone. We call it the abutment, and the parts that's inside the bone, we call that the implant body. The implant body parts, this part right here, usually is the part that been put underneath the bone in surgical phase 1. After it been put inside of the bone, we wait about 3 to 6 months for the bone and the implant kind of integrate with one another. Then we do what we call a surgical phase 2, where we place in the abutment. After the abutment is healed about a week or two, we will place in what we call a crown. Okay. One of the questions usually been asked is when we do surgeries to put in the implant body, do we need to put to sleep to do that? The answer is no. Most of the time, the patients will be able to have the procedure done just with local anesthetic. That is the numb shot that we usually give when we do our fillings. Um, on rare occasions, for example, the patient have a severe fear or the patient have a disability, Down syndrome, etc., that then we need to put the patient to sleep to do that. But most of the time, we're able to accomplish the job with just a regular dental numb shot. Another question usually asked is what to do afterward with the surgery. There will be a minimal discomfort afterward. There's a little bit of swelling, a little bit of bleeding. The bleeding should stop within 1 or 2 days. And we usually provide some antibiotic and some painkiller for the patient to go home. Here is the instructions of what to do after the surgery.
After your permanent restorations have been placed on your implants, it's important to follow these recommendations to ensure their long-term success. If we used anesthetic during the procedure, avoid chewing until the numbness from the anesthetic has completely worn off. Brush and floss around the implants thoroughly but gently. We may also recommend special floss, brushes, mouth rinses, or other cleaning aids to keep the area free of bacteria. Take antibiotics or other medications only as directed. To reduce discomfort or swelling, rinse your mouth 3 times a day for 2 weeks with warm salt water. Use about 1 teaspoon of salt per glass of warm water. It's normal for your gums to be sore and swollen for a few days. Avoid using any tobacco products. Ideally, you should quit altogether because using tobacco increases the risk that your body will reject the implants. Tobacco is a leading cause of implant failure. Also avoid grinding and clenching, as well as chewing ice and other hard objects, because these habits can damage the implants and their restorations. If grinding and clenching continue to be a problem, we may need to adjust the restorations or have you wear a night guard. Call us if the restorations feel loose so that we can tighten them. Call our office if you have persistent discomfort or if you have any other questions or concerns.
That's it. That's the end of our video for today, talking about a little bit about a dental implant. I hope it's clear up a little bit about the dental implants for you and answer some of your questions. Thank you for watching.